Hello and welcome to this video on acupuncture. While we plan to put a pin in the acupuncture balloon, the industry as a whole seems surprisingly resilient to bursting. Acupuncture is a more than 2,000-year-old treatment which practices began in modern-day China. It is based on a mysterious systems of meridians in the human body which channel energy. It is blockages of these meridians that lead to disease, and unblocking the meridians leads to improvement or curing of disease. This is done by the use of local pressure, the use of needles, and other direct forces such as cupping. This is said to cure gastrointestinal, neuronal, muscular, and more categories of pathology. Some of the meridians that are affected by this direct application of force do correspond with the locations of neurons within the body, while others do not. As acupuncture is one of the leading complementary and alternative medicines, we must repeat the quintessential quote by Tim Minchin: "Alternative medicine that works is called medicine." Like other treatments, such as homeopathy, it is often the beneficiary of the placebo effect. Research into acupuncture has been ongoing since the 18th century. Since the 18th century, methods of conducting research have improved drastically. This is why we have modern medicine, things like antibiotics, antivirals, antiparasitic medication, effective surgery, anesthesia, the list goes on. Many of the practices from more than 2 millennia ago are no longer used. Today we rely on properly conducted clinical trials to validate treatments, not ancient superstition. We also have the capacity to conduct meta-analyses. These two factors provide for an opportunity to thoroughly investigate the merits of acupuncture and the mechanisms of action. In fact, as of 2013, more than 3,000 clinical trials have been conducted. That is, 3,000 possible opportunities to not only identify a reliable pattern, but to explain how acupuncture works. This should be done in a repeatable, reliable, and effective manner that is done as per all normal clinical trial processes. This leads to the current front-running theories for how acupuncture works, and this is sometimes demonstrated in clinical trials, often those that claim to have a positive result, or a result that supports the use of acupuncture. This includes things like activation of somatic autonomic reflexes. These are your stress responses when you're exposed to a threat or danger. They improve the function of the cardiovascular system for a short time, increase heart rate, shifting of blood pressure, and so on. Then there are claims that acupuncture will influence the number and nature of neurotransmitters. Primarily they focus on serotonin and dopamine. These are supposed to help with emotional cravings, such as those from nicotine. The problem with this research is that much of it is based on meta-analyses, and this uses the existing literature and rates it to get a quality of these. Depending on which particular method taken, they can be rated across a spectrum as good, bad, or neutral, and so on. This methodology looks at how sound the studies are and how they can reach the conclusions that they do. This is then looked at skeptically and graded accordingly. That by itself is fine. Well, fine except for one thing. Very few studies pass the minimum standards to be incorporated into these meta-analyses. That's how bad they are. In fact, often very low, single-digit percentages of the available literature will pass. One extreme example is a case out of a possible 453 studies, 7 were good enough, a 0.9% success rate. The problem with these studies varies from one to another. Often it's the lack of a sham group. You may have a control where no treatment is given, a treatment group where acupuncture is used, but no group who think they are receiving acupuncture but actually aren't. This means that the different groups, if we're only looking at a control and treatment group, may have very different outcomes, but you don't know whether or not the acupuncture itself is the underlying cause for this difference. That's just one example of why these studies often have a very low rating in meta-analyses. As there are many different applications for acupuncture and possible mechanisms of action which are unproven, we'll examine some applications. Specific applications because the meta-analyses are done by the Cochrane Group. Cochrane reviews are considered some of the best possible sources of meta-analyses because of how thorough they are. The first is lower back pain, and what they found is summarized as: the incidence of adverse events may be similar between acupuncture and sham, and between acupuncture and usual care. Adverse effects related to acupuncture were considered minor or moderate. In simpler terms, acupuncture was only as good as regular care at best, and at worst may have had minor or moderate side effects. The other is depression, and acupuncture here is a little more complicated. They report it as: acupuncture may result in a moderate reduction in the severity of depression when compared with the treatment as usual or no treatment. Use of acupuncture may lead to a small reduction in the severity of depression when compared with control acupuncture. Effects of acupuncture versus medication and psychological therapy are uncertain owing to the very low quality of evidence. This means, in effect, acupuncture hasn't ever really been tested against the current methods of treatment, psychological therapy, and antidepressants, either individually or together. Claiming that it works for them in this case would be like trying to say that in theory a car could run on something other than petrol, but you're never going to test it against any other kind of fuel, just petrol. The problem with this and other research into acupuncture is generally quite simple. Specific conditions such as back pain, which have limited or little evidence, often come up against a very simple wall. It is not especially efficacious, but there is something there, and while something like back pain may show benefit of some kind, knee or shoulder pain may not. All of these rely on the same mechanisms to generate the sensation of pain. A treatment that selectively only works on some conditions and not for others, while being the same treatment, and not being able to even reliably treat that one condition, is not a treatment. It is at best a gamble, and at worst a terrible placebo. Imagine if you were to take aspirin for a headache, and there was a 50-50 chance that the aspirin would work this time. Or if you took paracetamol or ibuprofen for muscular pain, for example your knee, but it would only treat your shoulder. The treatments should not be that selective based on how these things are working, and in the case of pharmaceutical interventions, or even in the case of acupuncture, the mechanism at play should be consistent between locations. One quote we found while researching into this reads, "While there is no question that some great scientific research is done in China, there is evidence for a systemic problem with the conduct and publication of alternative medicine studies there. Studies reported as randomized are most often not actually properly randomized, and one review in 1998 found that no negative studies of acupuncture had ever been published in China." This is another factor to be aware of. China appears to take some pride in traditional Chinese medicines, including acupuncture. There is a strong effort to promote it to the West. As far as cultural exchanges go, that's fine. The problem is research into it. China produces the vast majority of research into acupuncture, and there's almost no area of research ever that should never have been able to publish negative results anywhere. The fact that China has not published negative results since 1998 is a big problem. It means there's something fundamentally wrong with the research they're doing. No matter how good you are always going to get something wrong or miss a key variable. Something will be there that leads to you either finding results that are not statistically significant, or that simply fail to produce the results anticipated. As you can see, we've not been able to support the conclusions that acupuncture works. Not just that it broadly does not work, but even specific applications are not supported by clinical evidence as a whole. As a mechanism, acupuncture doesn't work. Of course, anyone can cherry pick one or a few studies that are going to support acupuncture or go against it. This is called cherry picking. It is why we relied on meta-analyses. These look at the balance of the whole of the relevant literature at a given time. It looks at the quality of the research. It also fits the data to a big picture and tries to figure out, is there evidence here that supports, in the majority of instances, the treatment being proposed, or does the treatment proposed not have support? In the case of acupuncture, meta-analyses do not support its use. The final point to take home with you is this. Large-scale, quality clinical trials outside of China cannot replicate the efficacy of acupuncture. Any of the large-scale clinical trials with robust designs and sample sizes were unable to create a predictable effect. This is more or less the definition of a placebo effect, where it works on some people but not others. The important thing with this is that it may be part of a large-scale cultural placebo within China. There is also the aforementioned issues around the validity of research done in China and the results being published. Are they only publishing positive results? If you can only be affected by acupuncture within China, or only China is able to produce results, is there a vested interest in it being successful? These and other questions aren't going to change the underlying research, and the reality is the research shows that there's no real support for acupuncture as a medical intervention. There may be some benefit to be said for it, much like with homeopathy, in providing a psychological crutch to help people get through what they're dealing with. The fact that somebody's giving them the dedicated time and attention, the fact they're being given a treatment, even if the treatment has no real effect, can help them trick their mind into feeling that much better about what is happening. The issue is when people start to use something like acupuncture, homeopathy, and other complementary and alternative medicines in lieu of actual medical treatment. Thank you for watching this video. If you have found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions that you have below.